Welcome to another episode of 5 Minute Rule. Today we are going to discuss about the much dreaded coronavirus. Let's take a look at how the coronavirus spreads. When a person who is sick and is in the vicinity of someone healthy, the virus can get into the healthy person's system through their eyes, nose, or mouth. The viral infection manifests in different ways. You'll experience fever, cough, shortness of breath, and even gastrointestinal problems. In severe cases, this will elevate to pneumonia, severe acute respiratory syndrome, kidney failure, and even death. This can get us worried, and we'll be wondering what is the treatment for this viral infection. At the moment, there are no vaccines or antiviral drugs available, but don't fear, the symptoms can be treated. Now, let's talk about some precautions you can take to prevent coronavirus. We need to regularly and thoroughly clean our hands with alcohol based hand rubs or wash them with soap and water. What does it mean to be thorough? It is very important to wash the back of your hands, between the fingers, under the nails for at least a good 20 seconds. And when do we need to wash? After you cough and or sneeze, when you come in contact with a sick person, before, during and after you prepare your food, before eating, after using the toilet, when your hands are visibly dirty, and after handling animals and their waste. The respective healthcare providers in our countries have been giving us a lot of advice. It is very important to follow these instructions to stay safe and healthy. A good way to reduce the risk of getting this virus is by wearing face masks. When do we need to wear face masks? If you are taking care of a person who is suspected of having this viral infection. And you also need to be wearing a mask if you are coughing or sneezing. Now, masks are only effective when used in combination with frequent hand cleaning using alcohol based rubs or soap and water. If you wear a mask, you should be aware of how to use it properly and dispose it after its use. Let's take a look at how to put on, use, and take off a mask to dispose it. Before handling a mask, we need to clean our hands. When covering our mouth and nose with the mask, ensure that there are no gaps between the face and the mask. Avoid touching the mask while using it. If you do, please ensure your hands are clean. We need to replace the mask when it gets damp. We should never reuse a used mask. We need to remove the mask from behind and be careful not to touch the front of the mask. Discard the used mask into a closed bin and wash your hands immediately. What does it mean to maintain social distance? We need to maintain a distance of at least 1 meter, that is 3 feet, between ourselves and anybody who is coughing or sneezing. We need to avoid touching our eyes, nose, and mouth. Our hands can transfer the virus to these. We need to practice respiratory hygiene. We need to make sure that when we have people around us, we cover our mouths and nose with a tissue or napkin while coughing or sneezing. If you do have a fever or cough or have difficulty in breathing, seek medical attention immediately. Follow the advices given by the healthcare providers. Let's work together to avoid this virus by staying safe, healthy, and practicing good hygiene.